Namaskar. Me, Dr. Prashant Agrawal, orthopaedic surgeon at Apollo Hospitals, Navi Mumbai. I am going to discuss about non-invasive modalities of treatment for knee pain. First, we know what are the causes of knee pain. Most important cause of knee pain is osteoarthritis. This is an age-related disease where normal wear and tear of a joint leading to arthritis. And how this arthritis presents is with pain, stiffness, restriction of movement and disability. Now, once you have all these symptoms, you are going to go to doctor. Doctor will do clinical examination and confirm the diagnosis by doing some investigations. The basic investigation like X-ray will give you diagnosis of osteoarthritis, where you have a reduction in joint space, subchondral sclerosis, or some deformity and osteophytes around the knee joint. Now, if you want to make a treatment plan for this condition, we have to divide it into various groups like exercise, physiotherapy, medication, injection therapy, and surgical option. Now, exercise is the best modality of treatment and first line of treatment, which improves the function of a joint, which reduces the stress on the joint, which increases the strength of the muscle, which also improves the range of movement at the knee and reduces disability. In addition, this exercise also secretes some endorphins and which acts as a natural pain medicine for this condition. So exercise are again joint mobilization and joint stretching exercise. In joint mobilization exercise, we move the joint in the full range and which improves the function of a joint, and muscle strengthening exercise which improves in strengthening the muscle and which improves the function of a joint. Now, if you exercise and medication, in medication we give pain medication like paracetamol or acetaminophen or COX-2 inhibitors. These medications should be taken for short duration to reduce the pain at the joint. It also reduces the inflammation caused by the condition. Now, if this medication and your physiotherapy does not work, the next option we have is the injection therapy. Injection therapy again has various types, and based on patient condition, based on patient's morphology, based on patient's requirement, we choose the injection therapy which is going to relieve the symptom of a patient. But this is not a permanent solution for treatment of osteoarthritis. These are all time-buying procedures. Meaning injections, if joint is inflamed, we can consider giving anti-inflammatory like a steroid injection, which are safe if patient has no diabetes or if diabetic patient has a controlled diabetes. In diabetic uncontrolled patients, there is a risk of infection and exacerbation of a symptom. So usually whenever we decide to give a steroid injection, we check the sugar of the patient and rule out the possibility of diabetes, and if it is controlled, then only we consider injection of a steroid. Second option we have is a viscosupplements. These are the lubricants injected into the joints which also reduces the pain and which also improves the function of a joint. Third type of injections are biologics, where patient's own blood platelet cells are segregated and these platelets are injected into the knee joint. And these platelets, once they go in the joint, they induce the process of healing in the damaged cartilage and it reduces the symptom. In addition to these injections, again patient will have to continue doing exercise, because exercise will again improve the joint function and it will also improve the range of motion. Next option, if your injection does not work, then we have to consider surgery, where we can do a arthroscopic debridement of a joint or a joint clearance. Before that, to know more about the joint anatomy, we can subject these patients for MRIs, and MRI can give us a fair idea about the joint and internal structures. If there is an associated injury to the meniscus because of degeneration, then that can very well be tackled with the help of arthroscopy, and patient can have a painless stable joint for quite some time. This also progresses, then we have to consider deformity corrective surgeries like osteotomies around the knee, where femoral osteotomy or tibial osteotomy can be done to correct the deformity and to relieve the symptom of a patient. If this also fails, then we have option of total knee replacement, where the joint is exposed and the cartilage area is replaced with the help of a implant. It's like putting a tile at the end of a bone. Cartilage is removed and tiles are being put with the help of cement, and these damaged cartilage is removed, and now movement is occurring between the implants, so patient has a stable and painless movement at the joint. Thus, I will brief. Knee joint pain is a very common symptom what we see in the OPD. Females are more affected than males. Age group is 55 to 65 years, and we have to again consider comorbidities and associated risk factors to get the better outcome in treatment of these patients. Like somebody is obese, he has to reduce weight. Somebody is diabetic, he has to control diabetes. Somebody has associated renal or liver problem, then they need to control so that they get a better outcome. Thank you very much.